Good. So, pleasant good evening, guys. Always a pleasure to be in your company. Yours truly, Dr. Jason Batson, the Senior Medical Director at Batson and Associates, where we support your health naturally. So we had to do one or two little changes, shifts. So we're not in our regular studio. I hope the lighting and I hope the audio is good as regards to what we going to discuss. So we usually have our hormonal symposium on hormonal balance on a Monday night. So that's actually tomorrow at 8:30. Good. And last week, Sunday, we didn't get to do this program that we are accustomed doing. So we do apologize for that. We just had some, as usual, you always have some last minute something to deal with when you're dealing with health and medicine and helping, sick people to feel better. So we do apologize for that, but we are here this evening and we are live on our social media platform. We are Batson Associates Ltd on Facebook, and the program is live. It is interactive. I'm using a different device here. We normally use the computer, but I'm actually using a phone tonight. So I should be able to see your questions and whatnot. So what we're going to discuss this evening? We're going to touch a bit on diabetes, one. We also going to have some discussion as regards to hypertension, because hypertension, of course, plays a significant role in the issue or as an issue with a number of persons in Trinidad and Tobago. Our diabetic numbers continue to climb significantly. We actually have a high population of diabetics. They estimate that 1/3 of the population of Trinidad and Tobago is diabetic. Now, that's not a good thing, eh? That is an indication that we're in some serious issues as regards to those lifestyle. Look at the operative word, lifestyle diseases. So that's something that we need to really pay very, very close attention to as regards to diabetes. Let me say a pleasant good evening to Ms. June Jatan. She has joined us. Loving the home. Thank you so very much for that compliment. And keep in mind, again, as I said, we're discussing health from a natural and integrated perspective. So let's just do a little recap. What is diabetes? So diabetes is a situation where you have excessive blood glucose that is in or stays in your bloodstream for an unusual amount of time. Essentially, that's what diabetes really is, because you have to understand that glucose is what? The simplest form of sugar. Where is glucose needed in the body, or what is glucose used for? Glucose is used as energy. But the thing is, glucose is supposed to be stored in your cells. And when the body requires the glucose, then it is supposed to be used by the body, primarily your brain. Good. But with diabetics, that doesn't happen. With diabetics, what happens is that glucose remains in the bloodstream for an unusual amount of time. And that could be caused by any aspect of diabetes. A lot of people do not understand that diabetes too as well is not, we know about type 1 diabetes, which is insulin dependent diabetes. We know about type 2 diabetes, which is diabetes mellitus. And we also know about type 3, which is gestational diabetes. But there are a lot of other types of diabetes. You have early onset diabetes, you have glucose intolerance, you have hormonal imbalance related diabetes, which is similar to when women have things like polycystic ovarian syndrome and those type of things. So it's very important and it's very necessary that you really understand what you're dealing with. So if you have been diagnosed as a diabetic, it is vitally important that you understand what type of diabetes you have, or what is the root base or the root cause, of your particular diabetic situation. Okay, guys? Keep in mind again that we are live on our social media platform. Let me say a pleasant good evening to Joss Adlin, Miss Marcella Smith Fontenelle. Pleasant good night to you, Miss Rosemary Bishop, Ruby Samui, as well as Miss Erla Williams and Miss Anne Leger. Good. So that is the main aspect of what diabetes really is. So of course the question arises now, if you are diagnosed as having diabetes, What is your first step? What should you do? So you go to the doctor, and the doctor does a test on you, and the doctor tells you, listen, Miss A, Miss B, you have diabetes. How do you address that situation? What's the first thing you should do? The first thing you should do is look at what you was eating for the last year, the last 6 months to a year. Look at what you have been eating. So if you really check back yourself, you might have realized that you may have been under stress. I don't know, you may have been a university student, you may be studying, you may have been caring for a ailing loved one. You may have been in a situation where you had high stress related issues. Now, because of these stress related issues, that could have contributed to your diabetes. In addition to that, you may not have been getting time to take care of yourself. You may not have been eating your meals on time. You may not have been drinking the correct amounts of water. You may have been focusing on the children. You're busy, you're doing things. So you're not really getting time to take care of yourself. So as a result of that, you could have been now diagnosed as being diabetic. So the point I'm making, not because you have been diagnosed as having diabetes, means that you have to always have diabetes. I'll say that again. Not because you have been diabetic or told that you have diabetes or you have a diabetic situation means that you have to have diabetes for the rest of your life. That's a very deep statement there. It's also a very controversial statement too as well. Because a lot of people would say, but if I have diabetes till I die. No, I disagree with that completely. I don't care what type of diabetic you are. What it means is that you have to be willing to do the work to get the results that you want. You see, there are a lot of persons who are diabetic, but they're not willing to do the work. You have to do the work. And doing the work means what? I'll help you to understand that in a little bit. Let me say a pleasant good evening to Miss Alicia Walker. She's out in New York there. Miss Wendy Andrew, Pinky Pink. She says, good night, Dr. Batson. I am multitasking now. I am watching the cricket. Have a blessed night. Yes, my dear. That cricket could damage your heart, you know. Careful, you know. Make sure and have something there for your heart with that cricket. Yeah, so in an instance like that, it is vitally important that you determine and analyze your situation, especially close to when you have been diagnosed. And I'll tell you why. I'll give you an example. There's a young man who came to us, Mr. Isat, sir. Always a pleasure to have you in the house. A pleasant good evening to you. Ms. Shireen Jack, good evening to you as well. Yeah, so let's say we're going back in time. So let me give you a note. I was going to give you an example about a client who came to me. So this particular gentleman came to me and he brought a test telling me that the doctor told him that he's diabetic. I say, okay, fine. Where is your HbA1c? Meanwhile, a HbA1c is a test that looks at your blood glucose over a 90-day period, which is 3 months, and it could actually tell how much glucose was in your bloodstream because it's a HbA1c. So what it does, it actually looks at the glucose, how it attaches itself to the red blood cells, right? So I asked him, I said, did you do a A1c test? He said, no, the doctors didn't do a A1c test. I said, okay, if they didn't do a A1c test, how is it that you are diabetic? He said they did a fasting blood sugar test, and the doctor told him, based on the results of the fasting blood glucose, he is diabetic. So I asked him what was the result. He told me the blood glucose test read over 300. I said, well, yeah, that's cause for concern. That could be an indication that you are in fact diabetic. However, a A1C should have been performed. But in any case, I told him, I said, so I asked him some questions. I said, what you was doing for the last 3 months? What's going on with you? You have stress, you have children, you have wife, you have problems. What is the issue? He said, well, he was under a lot of stress. You know, he was running up and down because he has his own business. And apparently he had lost some employees, whatever the case may be. So because of that, he was working longer hours. He was under a lot of stress. He wasn't eating on time. He wasn't able to eat, you know, home-cooked food. He was buying a lot of food outside and that type of thing. So instantaneously, I realized, but obviously, you wouldn't be the normal person that you're accustomed being under that stressful situation. So I told him, I said, here, what we're going to do. I made some changes to his diet. I included some nutrition from a supplemental perspective. So I recommended a vitamin D3. There's a product we carry at Batson Associates called blood sugar control. Which is a natural product that is designed to take with your meal to actually help to regulate blood glucose levels, because it doesn't encourage spiking in your foods. He told me he used to drink soft drinks. I took him off of the soft drink. I said, no soft drink for a little while. I want you off of that. And I cleaned up the diet. I increased the water intake as well, because I actually wanted him to consume more water. So in that particular instance, we were actually now able to make those necessary changes. And in making the necessary changes, he actually was able to get better results. So when we work with him over the period of time, what we were actually able to do is assist in bringing down the blood glucose levels, because he had to test them every day. And over a 2-month period, we were actually to work to bring that blood sugar, or that fasting blood sugar, down to 105. So he moved from 300 plus to 105. So that, of course, is a perfect. And meanwhile, he didn't have to use any medication. Even though medication was recommended originally, because we made the necessary changes to the lifestyle and addressed the imbalances in the body, we were actually now able to give him better blood sugar readings. So that is just an example there as regards to what is possible for individuals who are diabetic. So if you're a diabetic for 10 plus years, 5 plus years, 2 plus years, and you almost reach a point of being fed up, because I think all diabetics, one of the major issues that they experience is that particular issue of, you're just fed up. You're tired. You're exhausted. You're fed up. Choke yourself. You're fed up. Take blood. Who like to choke themselves with a needle? Anybody? Who do you know loves to stick themselves with a needle? Most people don't like to do that. They despise doing it. And the reason for that is because they want to live a better life. You don't want to have to be constantly worrying and stressing out yourself to find out, you have to walk with your insulin. You have to constantly be sticking yourself in the morning. That's not nice. But the thing is, you're already in the problem. So you can't just, be like the ostrich and just take your head and stick it in the sand and say, well, if I don't see the problem, it means it's not going on. You can't do that. That's going to cause a lot of problems. So it is a matter now of literally grabbing the bull by the horn and say, listen to me. I am in a situation. It's not the best of situations, but I want to get better. I want to get help. I want to manage my weight. I want to bring down my stomach. Do you know that the larger the circumference of your waist is, so in other words, the bigger your belly is, the more likely you are to have serious debilitating problems? Your likelihood of developing diabetes with a larger waistline is significantly higher than someone who has a smaller waistline. Now, I'm not saying that slim people don't get sicker. That's not what I'm saying. But what I'm saying, what you have to understand is you have to be able to make the necessary changes to bring about the correction that you desire. Very, very important. Yeah. June Jatan says she hates that. What do you hate, June? Sticking your fingers? Yeah. Or the big belly. Nobody likes a big stomach. And a big stomach is an indication that something is wrong with you. Because you see, the thing is, most people who have very big stomachs, they have something known as excess visceral fat. What is visceral fat? Visceral fat is organ fat. And organ fat is responsible for causing a number of issues in the body. A number of issues. Organ fat actually is known as fat that has inflammatory chemicals in it. So it actually have things like prostaglandins, cytokines, those various things that would actually now assist in killing you while you sleep. You all heard what I just said there? Visceral fat produces and releases inflammatory chemicals, example, prostaglandins and cytokines. And the job of, you all know what chronic inflammation is? I'm asking a question. Chronic inflammation. Anybody? Could you tell me what chronic inflammation is, or have you ever heard about chronic inflammation? Miss Susan Q says, hi, good night. My husband suffered a major stroke and he is a diabetic. Can't exercise due to lack of movement. How can I help him? He's on metformin and glycoside. Okay, well, if your husband suffered a stroke, I would imagine that he would have done some sort of physiotherapy. I don't know how recent that physiotherapy was, or if you maintain his physiotherapy sessions, but that is something that you should really look at doing as regards to that in terms of his mobility. So is it that you're saying after the stroke, he never got any sort of mobility? You could highlight, or you could give me a little more information. Definitely we could help in improving the blood circulation, improving the body in such a way that he does not get strokes, because you don't want that to happen. So it's very important that you pay very close attention to that. Ms. Chandra Sanka is saying no. No, okay, right. No as regards to what, Chandra? Because I just saw you had said good night. Yeah, I'm working on the phone tonight. Normally I have a very large computer in front of me, but we will work with what we have to work with, right? Ms. Irma Macmillan says, good night, Dr. Batson. I was told I am pre-diabetic. What can I do to reverse it? First thing, look at your water intake. The rule for drinking water is your body weight divided by 2 in ounces. I also suggest you do some sort of assessment at Batson Associates, and I was just, speaking to someone a while ago as regards to the live blood analysis. Let me tell you why I like blood analysis so much. Blood analysis gives you truth. It gives you truth in the sense that if you lie to us, if you come into the clinic and lie and tell us you eat lettuce, you eat a lot of salad, you exercise, you walk around the Queen's Park Savannah, you drink your required amounts of water and whatnot, the blood is going to tell us exactly what you do. That is why I like blood analysis. It is one of the only tools that visually, for a trained eye, has the ability to tell you multiple things about the body. Multiple things about the body. The thing is, not everybody could do blood analysis. At Batson Associates, we have trained consultants. Well, I don't do blood analysis again because of my time, and I simply consult. But we have persons, and that is a protocol that it is established. You have to do that blood analysis when you come to us. And that's not because I feel to take your money. It is because we want to determine and see that biological terrain. It is very, very important for us to see that biological terrain. And blood does not lie. Your blood don't lie. You could sit down and tell me what you want to tell me on that chair. When we do that examination and we look at the live blood, because we take blood from your finger, you tip your finger. And that capillary blood tells a story. And the story that it tells is a story of what you eat, of what you drink. It tells a story as to whether you sleep. Do you know in our blood analysis, we could tell you whether you sleep or not, if you have sleeping problems. It gives us an indication of your digestive system. So if you have undigested lipids, you all know what lipids are, right? Lipids are what? Fat. If we've seen undigested lipids in your blood, that is telling us a whole host of things. Here what it is telling us. You have a problem with digestion. It's telling us that the possibility exists that you have gallstones. Because people who get gallstones are people who do not metabolize or digest fat properly, and people who eat the wrong types of fats in the diet. Trans fat. That's all of you all who like all the fried foods. Butter. The orange butter that people just cook with. I don't even believe people still cooking with that butter. Plenty salt. You see it. Because the blood tells you, remember blood, and we take a drop of blood. So imagine if we see in all that manner of confusion, chronic inflammation, we see in disease in one drop of blood. You could imagine what is going on in your body, the body that we took that sample from. You could imagine what's going on. You could never be healthy with unhealthy blood. Never. I tell you so. Anybody tell you other than that they're mad, they need to go and get a head check and examined. I'm one of the most spoken people that you'll ever come across. Plain. There are plenty of people who can't take me for that. And I really do business. I tell you like it is. You like it or you don't like it, because it's your life we're talking about here. We ain't talking about you going to buy a car or real estate or your garden. We're not speaking about that, you know. What we are speaking about is a disease that you have that is killing you and making you less of yourself. Because if you're a man with diabetes and you're a young man and you have a young wife, you're going to be in problems. You'll be in serious, serious problems. If you are an older man and you have diabetes, you will be in problems. Sickness is not fun. Sickness is not a walk in the park. What it is an indication that something is wrong. And if something is wrong, there has to be a way to do what? Correct it. You have children, if your child going to school, the child in standard 1, they ain't doing good. They in standard 2, they ain't doing good. They in standard 3, they get done, sir. You gonna leave them in the school? No. You need to change it. Something not working is either your child not understanding what the teacher is teaching, your child has a learning problem, something. But what I'm saying, as a concerned parent, you're going to go and do some sort of investigation to fix the problem. So if something is wrong with you, from the physical perspective, something is wrong. You always have headaches. You're not sleeping good. You have acid reflux. You're constipated. Once for the week, you getting a visit to the washroom. Your body is telling you something is wrong. And if you continue to leave it like that, you will eventually pay the consequences. As I was telling someone a while ago, I will take the questions shortly. You can only reap what you sow. Let that sink in. You can only reap what you sow. So you're licorice and you're greedy and you don't listen to nobody. You're licorice, you're greedy, you just want to eat everything in sight. Your body will pay the consequence. Always remember that. So let me look at some questions here. Let me see. So so Irma Macmillan says, good night, Dr. Batson. I was told I'm pre-diabetic. What can I do to reverse it? So as I told you, you need to look at your water intake. All the sugars that are processed, take it out of your diet. If you like coffee, stop drinking it. Take a rest. Because you see, there are certain changes that you'll have to do in the body to bring about the change that you want. Okay? Miss Pamela Moses from South, how are you doing, my dear? I hope all is well with you. Good night to you. Mr. Isat says, how to increase metabolism in order to lose weight? Good question. A good way to do that, Mr. Isat, apart from using Santulan, which is a 7-channel detox, because what Santulan does, Santulan jumpstarts your metabolism. How so? Santulan is a 7-channel detox. So it means that that product cleans and detoxifies kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. So it now means that if you do a detox of that magnitude, and it's a very easy detox to do, what you do now is that you automatically now jumpstart your metabolism. And in jumpstarting your metabolism, Mr. Isat, you now have or help your body to burn fat. One of the things you could also pay attention to is, apart from the Santulan, that 7-channel detox that cleans and detoxifies kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs, is actually now, we could do a protocol for you there. Because the thing is, everybody, we all the same, essentially, but we are also different. Sometimes your problems, your diabetes, is not necessarily caused by the same reason your sister have diabetes, you know. There's what is confused people. People automatically just put everybody in the same category, you know, which is why when they go to the doctor, they give everybody the same drugs. But that's not the case. That could never be the case. That makes absolutely no sense whatsoever at all, at all, at all. Anybody who understands anatomy and physiology and understands how the human body works will understand that that does not make sense. That you have to do something specific to you. But in terms of generalization, what I know for sure, if you drink the required amounts of water that your body needs, you automatically start to do good for your body. We know that you're not supposed to just take water and gulp it down like that, like a crazy person. You should sip progressively sip, I call it. Because you can't just sit down whole day and sip, sip, sip. You don't have enough time. You go sip, drink water whole day. You know, you have to be practical in what you're doing. But of course, drinking the required amounts of water is what is necessary. All right, Mr. Isat, you could check out our Santulan, that 7-channel detox that cleans and detoxify kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. Ms. Chandra Sankar said, Dr. Batson, I am also a diabetic and I find I am having lots of neck pain on the right side. Well, the thing is, pain is usually an indication that something is wrong. It could be, once you haven't damaged yourself, I don't know if you ever did any x-rays, if you ever did any MRIs, any CT scans, or anything like that. But that is also something that you could pay very close attention to as regards to that. If that is not the case, it could be early signs of arthritis. What is arthritis? Arthritis, is primarily inflammation or a chronic issue in the musculoskeletal system. So your musculoskeletal system comprises of your joints, bones, tendons, ligaments, etc. So if you have an inflammation in the musculoskeletal system, you are going to be diagnosed as having arthritis, which could cause joint pain, swelling, that type of thing. You remember I asked you all a question earlier about chronic inflammation? So if you have chronic inflammation in your musculoskeletal system, you are going to be diagnosed with any of the following: rheumatoid arthritis, osteoarthritis, psoriatic arthritis, fibromyalgia. If you have issues with inflammation in your cardiovascular system. So what is the cardiovascular system? That comprises of what? All your blood vessels, so capillaries, arteries, veins. It also comprises of what? Your heart. So if you have inflammation in your cardiovascular system, then you're going to have what? Blocked arteries. You're going to have angina. You're going to have cardio disease, where you have chest pains and bradycardia and all those cardiac diseases, which are imbalances in the cardiovascular system as a result of inflammation or inflammatory response in the cardiovascular system. You all understand? So when people complain about being sick and people complain about having all these issues, like I feel very sorry. Well, not sorry. I'm always concerned about lupus patients and persons who are diagnosed with autoimmune conditions. I'm actually, just finished to the point where I'm now an autoimmune specialist, consultant. So very soon I'll be doing work with a lot of more autoimmune conditions, because there are so many of these persons who have things like connective tissue disorder, myasthenia gravis, lupus, Crohn's disease, irritable bowel syndrome, diverticulitis. When you have inflammation of the gastrointestinal system, so that is what? That's your mouth going down to it with your tongue, teeth, esophagus, stomach, small intestine, large intestines. When you have those type of imbalances and you have chronic inflammation in your gastrointestinal system, then you're diagnosed with things like inflammatory bowel disease, IBS, Crohn's, diverticulitis. All those are as a result of chronic inflammation where? In your gastrointestinal system. So that's how diseases is getting named, and that's why I tell persons your disease, or I should say your analysis or your diagnosis, sometimes is irrelevant. You know why? Because it is a symptomology or a cause. Where's Newton's law of motion? Every action, to every action, there is an equal and opposite what? Reaction. That's our law. I wonder if I remember in the physics correct. Yeah, I believe is Newton. Yeah. To every action, there is a opposite and equal reaction. We could sort of play on the equal. It doesn't necessarily be equal. I think sometimes you get 10 times in your waist. So the thing is, when you do not drink water, and a lot of persons who are diabetic, you have to drink the required amounts of water. That's why you end up a diabetic in the first place. Because you were not drinking the correct amounts of water. The rule for drinking water is your body weight divided by 2 in ounces. Okay, Mr. Isat, I'll repeat that. So again, Mr. Isat, the rule for drinking water is your body weight divided by 2 in ounces. If you weigh 100 pounds, just for argument's sake, or let's put it easy, let's put it at 120. Half of 120 is 60, right? 60 pounds or 60 ounces in liters is what? Do a quick check on Google and look at how much 60 ounces is the equivalent to what number of liters. And that is the required amount of water that you should drink for the day. All right, Mr. Isat? There's our next question I get. Miss Jennifer Valentine. Okay, Miss Jennifer Valentine says, good afternoon, Dr. Batson and all lockdown. Dr. Batson, I'm asking for someone. This person had a cyst in her bladder. It was removed, but the specialist is saying that they have to do surgery to put a bag or some kind of mesh. What advice? Oh, well, the thing is, if they had a cyst in the bladder and the blood, it depends on the surgery or the way the surgery was done, you know. So depending on what the surgeon may have had to do, it may have required going into the wall, or maybe the wall, that person may have had a hernia or something like that. So it means that because of that, they may have to put in a mesh in order to block the abdominal wall there. Off the top of my head, it could be that. I wouldn't be able to give much advice because, of course, I do have the full details of the surgery. But I mean, it sounds like some sort of wall, because I know normally meshes are usually put in when you have to do hernia repair. So I don't know if because of the cyst that they had on the bladder, they may have had a cyst and a hernia or something like that. So you're going to have to get some more information where that is concerned. The good thing about it, we do protocols for post-surgical procedures. So if you know someone who may have done surgery and they want to get that body working faster, want to help the body to heal faster than normal, that type of thing, you could always also reach out to us, because that is something that we do as well in terms of dietetics and dietary protocols. Okay, Miss Denise Hurst, listening from Antigua, always a pleasure to have you. Irma Macmillan said prolonged inflammation, correct. And that is the question that I ask as regards to chronic inflammation. So when you have chronic inflammation, because you all know inflammation is a normal, natural response in the body, right? Without inflammation in the body, we will die. Inflammation is needed. What causes problems is when the inflammation is chronic, it is at a very high level, and as you mentioned, it is prolonged. That is when we are in serious problems. So again, it's vitally important to pay very close attention to that. So those of you on the live who listening, if you are in Trinidad and Tobago, keep in mind, we have our open clinic days at all of our locations. We are located on the first floor of Money Talks building. That is Money Talks building in Montrose, Chaguanas. As I said, I'm using a different device for this live. So normally I would put the telephone numbers and whatnot for you. So I'm just going to have to call them. I'll give you the easy ones, which is the 222-8261. That's 222-8261, as well as 314-9975. Again, that's 314-9975. Those of you overseas, I know there's a lovely lady in Grenada who I have to finish a consultation for. We weren't able to do it last week because of the schedule. And then when I finished, it was too late. I didn't want to call you that time. So this week, God's willing, we're going to get that in, just in case you're on the live and listening. And of course, we have our open clinic day in Chaguanas. We also have St. James office. We also have our Debe location, and we also have our Tobago. Tobago is the Triangle building in Scarborough, Tobago. And of course, that Londonville location where we'll be doing more work, because that's a ground floor office. So that office was primarily designed for stroke patients, persons who have serious issues associated with diabetic issues, stroke issues, serious problems with arthritis. You could take advantage of that clinic. So the telephone number, of course, you can get us on 222-8261. That's 222-8261, as well as 314. That is 314-9975. Again, that's 314-9975. And you could actually WhatsApp that number for us. So I'm looking through your questions. As I said, I'm working with a smaller device here, so I'm trying my best to see all your questions. Ronel Devine says, that's 57 bottles, 1.5, oh, 57, which is 1.5 liters of water. Ronel, that's what you're saying there? Yeah, she told me she has a hernia. I will give her the info. Thank you very much. Yeah. So you see, that's what I was saying. So I know it would have to be a hernia in order for you to have to do a hernia repair. The unfortunate thing with persons with hernias, what is a hernia? You have different types of hernia. You could actually have a umbilical hernia, which is closer to the navel. You actually have children, a lot of newborns sometimes have that. Women can get hernias after childbirth because what happened is the abdominal wall, the muscles, they're open, and because of the opening in the muscle, the intestines could now protrude or sort of push out, which is why people who have hernias, sometimes you see it's out like this, bulging, and then they could actually put it back in. Now, that is very dangerous. When you get hernias earlier, the earlier you start to address the hernia, the easier it is for you to deal with it. So the simple fact that with the hernia, you find that you're able to help those intestinal muscles to sort of close back in. The problem with a lot of individuals is that when your hernia gets too large, it is very difficult for it to be fixed naturally or fixed with some sort of physical manipulation like massages, stretches, and those type of things. Sometimes you have no other choice but to do the surgery because of how large the hernia is and how long you left it. The thing with hernias as well too, if you have a very large stomach, which is protruding, it means that because of the protrusion and the weight in front of here, it pushes the intestines out. And because of pushing the intestines, it causes the hernia to open wider. And as a result of that, you can end up in problems. So you need to be very careful. If you're a person who work and you lift up a lot of heavy stuff and things, you should ensure that you wear belts or wear some sort of harness to support yourself, because if you lift up very heavy things, you can also get a hernia as well. You find men who are masons, people who work in professions where you have to do a lot of lifting, a lot of bending down, stooping down, those type of things. You have to ensure that your midsection is very fit. That's why I tell persons, the more abs you have, or the stronger your abdominal muscles are, i.e. having abs, especially as you age, the healthier you are. It's very important to maintain a very healthy waistline. You don't know how much things you can save yourself from when you look at your waistline. It is very, very important. You're very welcome, Mr. Isat, sir. Ms. Heather George, she says, "Hi, Dr. Batson, I'm in Pennsylvania. I need to have a consultation with you. How do I get to have a consultation with you?" Okay, what you can do, Ms. George, you can WhatsApp us that information on 868-314-9975. Again, 868-314-9975. And once you do that, we will get on to you. We'll provide the necessary information, and we will do that consultation for you. Mr. Ronald Devine, he says, "My body weight is divided by 2 in ounces, workouts to 57 bottles of 1.5 daily." No. Something you're checking. You're checking, 57 bottles of 1.5 liter water. Now, Ronald, you check that wrong, man. Listen to what you have to do. How much ever you weigh, divided by 2. And when you divide it by 2, whatever weight you get, that weight is the equivalent in ounces. So you're not doing any multiplication after that. So, okay. So let's say, let me help you guys out here. Here, Ronald, I feel we do something wrong there, boy. Just now, let me check it. So, because, as I said, that rule. So those telephone numbers again, you could give us a call on 222-8261. That's 222-8261, as well as 314-9975. Again, that's 314-9975. Okay, good. So let me look now here. So I'm giving you an example. Let's say someone weighs 200 pounds. So 200 divided by 2 is 100, right? So it means, okay, right. So Ronald, all right, let me do your own. Ronald said he's 360 pounds. divided by 2, you're 180 ounces of water, right? 180 ounces so 180 ounces to liters, and that's how you get the answer. So I'm just trying to look here. Liters, no, ounces to liters. Right, good. So it means now that's 0.0296 liters, right? So it means now if you put in 180, right, Ronel? So Ronel, that means you're supposed to be drinking 5 liters of water for the day. It works out at 5.3 liters of water. So it's really 180 ounces. US fluid ounce converted into liters will give you 5.32 liters of water. Right, Ronald? That's what you're working on there for me, boss, man. Good. Right. Please repeat the WhatsApp number. You're missing a digit. Okay. So it's area code will be 868, and then it's 314-9975. Again, Miss George, it's 314-9975. Right, Ronald? So it was the 360 divided by 2, which is 180, which is the ounces, and then we convert the ounces to liters, and we get 5 point something. That's what I'm saying. Okay, because in mines, I am what? I'm 192, somewhere around there. 192, 193. So I normally consume like about... I consume usually for the day in excess of 3-4 liters. If I go to the gym, I consume more, like about 5 liters of water for the day. And listen to me, when you drink water, the way you're supposed to drink water, you know what you're trying to do, which is a bad thing? And let me give you some advice. Do not go from not drinking water to just go and starting to want to drink a lake or the ocean. That doesn't make any sense. You have to gradually increase your water. You can't go from drinking 1 glass of water a day or none, and you know yourself, to drinking 50 glasses of water for the day. You're very welcome, Miss George. So it's 868-314-9975. And you guys who are listening, if you want your appointments, you want to make the appointments, you want to find out more about the Santulan. Santulan is that 7-channel detox product that we carry. It is a product of Batson Associates that is primarily designed to clean and detoxify your 7 channels of elimination: kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. Miss Natalie Smith says, hi, Dr. Batson. We need to know how soon we can be seeing you in Tobago. You always see me in Tobago end of the month, which is like next week into week after. So anytime around there, I will be in Tobago. There's some work that we actually have to do in Tobago now. Tobago going to have to get things, because I'm telling you something, and I said this to someone recently. I mean, it would be a joy for me to really, yes, Miss Pauline McKenna, let me say a pleasant good evening to a very nice lady that I've known for a number of years, Miss Pauline McKenna, my dear. I hope all is well with you. Yeah, so as regards to, and as she rightfully said, sip, not gulp. And you could do a kind of quick enough sip, if you understand what I mean. Because the sip, I see some people sipping there, you ain't going to drink the amount of water. So make the sip make sense now. Give me a proper sip. Or the plain shy, like if you sip, open your mouth, sip. Right? Not gulp, but a quick sip. All right? What was the point I was making, boy? Something I was saying there. You're very welcome, Miss Smith. Oh, good. I was talking about the products at Batson Associates. So what you need to do, yes, Miss Valentine, I did, and I will be contacting you this week. What happened, I had clinic days on Tuesday and Wednesday. I had some really long days. And by the time I finished, it was pretty late, so I didn't want to call you that time. So those of you I would have put for next week, please God. So God's willing, by next week, Wednesday for the latest, I am going to do that consultation for you, Miss Valentine, and I'll call you and we'll talk over the phone. All right, my dear, I got it. I reviewed it. I just have some notes to write up, and I'll give you a call and we'll talk about it. Miss Alicia Spears, she says, good evening. Look, the boss himself, Dr. Batson. Thank you so very much. Yeah, guys, so We talk about diabetes. So all the diabetics out there, please, 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 if you're interested in a diabetic protocol for your eyes, reach out to Batson Associates. We have some really great products. We carry a really great eye drop. And the thing is, the experience that we have at Batson Associates is in excess of 15 years. I mean, me personally, as the executive consultant of Batson Associates, executive medical consultant, and then having senior consultants and consultants that work with us, you know, because we have been doing what we have been doing for the length of time that we have been doing it, and some people might think 15 years is not plenty, but believe me, 15 years is plenty when you deal with the amount of ailments and the number of people that we have dealt with. That gives you an experience like no other. Which thank God, I thank God for that every day, that I am so experienced in dealing with a multiplicity of diseases that it has put me in a place where I'm one of the best of what I do in the world, right? And I say that humbly, and God's willing, you know, you can always better your best. My aim is to get better and be able to provide better protocols, better clinics for people so that we can help as much people as possible. Because I'll tell you something, life is short. Those of you who believe in the Creator, whatever you want to call him, however you want to address it, that's your, I don't get into the religious politics. I try to stay out of politics on the whole, politics of anything, because I find people just argue unnecessarily. As adults, we should be able to agree to disagree, but unfortunately, not everybody thinks like that, and that's fine. But I'm a practical person, and you know, my approach to medicine has always been a practical one. And because of that practicality, I have gotten the success that I have gotten, and will continue after God to be successful and help more people, because I always believe that the body is not only a physical body. And when I studied medicine, integrative medicine, you know, one of the things that I always learned is that you have a spiritual body. And the spiritual body is the most important body. After that spiritual body, you have a supramental, which is your subconscious mind. After the subconscious mind, you have a conscious body, which is known as your mental mind or your mental body. Then you also have a vital body, which is your energy body. How do you think your heart beats? Do you know that your body has electricity in it? Your body produces electricity. Are you aware of that? So it means your body is an energy body. Your body is a vital body. And last but not least, you have the physical body. This, what is tangible, what stands before us. Because in order for psychologists and psychiatrists to analyze you, they cannot read your minds. What do? They observe your behavior. Behavior is tangible. You don't agree? Your behavior is tangible. Behavior is observable. Behavior can be observed. It can be analyzed. So your mental mind, that is what produces, that is what gives us the outcome, your behavior, the way you speak, the way you interact with people. That's why they could tell you whether you're a narcissist or you have some sort of psychosis or something. Because it is based on your behavior that analysis can be made. Behavior. But behavior can be analyzed. It can be observed. It is tangible. And most of the time, look, for example, postpartum depression. The only way we know a woman has postpartum depression, or most people have depression, is based on what? Their behavior. We can't read their mind. So I'm saying all of that to say that the body is one that is a spiritual body, it is a supramental or a conscious body, it is a mental body, which is the conscious mind, it is a vital body, which is the energy body, and the last body is the physical body. And we follow something known as downward causation. So the first body on top, which is the spiritual body, affects the supramental or the subconscious mind. The subconscious mind affects the conscious mind. The spiritual body affects the mental body, which is the conscious mind. But it also affects the vital body, which is the energy body. So all bodies essentially affect the physical body. And in Western medicine, medical doctors are only trained to deal with the physical body. I'll give you an example. You all ever heard of something called a dustbin diagnosis? Miss Valentine, what you could do, you could give her the office number, not my personal number, the office number, and I could always speak to her. Okay, I could always WhatsApp her on one of the office phones and I could have a conversation with her. All right? Yeah. You all ever heard of something called a dustbin diagnosis? I'll tell you all what that is just now. Joni Sman, a pleasant good night to you. Miss Indra Baliram. She says, good evening, Dr. Batson. Can you help with flashing lights in the eyes and floaters? Yes, we can. Miss Balaram, we have an excellent, excellent protocol for eyes. Extremely excellent. So you can always reach out to us. There's a product we carry called Anthocyanin Complex. That Anthocyanin Complex is actually a product that is designed specifically to assist with eye health. Okay? Miss Ruby Watson, she asked the question. She said, Dr. Batson, good night. This is my cousin. This is your cousin, sorry. Yes, Ruby, my darling. I haven't seen you in a while. Hope all is well with you. She said, what do you have for high blood pressure and kidney stones? Thank you. Ruby, there's a really good tea we have called Circulation Regeneration Tea. Right now, that tea making waves because it's a tea that was designed by myself. And I did some combination because I like teas. That was my training with the Chinese. I did holistic Chinese medicine. And I respect the Asians for that. Asian medicine is one of the most powerful medicines in the world because of their foundations, because of what they believe. They believe in bush. They believe in drinking hot tea. Why do you think the Asians drink so much of hot tea? And note, with their tea, there is no milk or sugar in the tea. No milk or sugar. So it begs to help you to understand that there's a reason why those people look the way they look. It comes down to their lifestyle. So we need to come out of this mentality that we have where you say now that, you know, I'm born with diabetes or diabetes runs in my family. If I was to take up that mantle, then I would have been diabetic a long time. I would have thrown in the towel and just eat foolishness and just get big and fat and just do. But I refuse to do myself that because I know better, I have better sense. I love myself plenty. I don't like headaches. I don't like to be sick. So it means if you value good health, if you value energy. So Ruby, you could check out the Circulation Regeneration Tea. If you have problems with kidney stones, I'm going to have to do a protocol with you for kidney stones because there are different types of stones and different types of stone require different types of protocols. You have calcium stones, you have magnesium stones, you have uric acid stones, and you have combination stones. Okay, Mr. Hayden Stewart says, good morning from the Philippines. Oh yes, Mr. Hayden, one of my favorite clients. Dr. Batson, me and my wife started the Santulan. My question is, should we continue taking the other stuff like the nerve formula and the other products? Yes, you should. Yes, you should. Because remember, Santulan is on an empty stomach. So you would have already taken what you have to take. And then when you use Santulan now, the Santulan is going to help to go in the system and do the necessary. So you can use your products. That's not a problem. Erica McCartney, she says, hello, do you have a product for children with ADHD? You missed out the H. Yeah, we do have products and protocols for children with attention deficit hyperintensity disorder. I could guarantee I could work with that child with that problem, and you can see significant improvement within at least a month time with that particular issue. All right. You're welcome, Miss Valentine. Karen Noel says, hi, Dr. B. It was nice meeting on Friday. God's richest blessings upon you. Thank you so very, very, very much. It was a pleasure as well for me. Okay. Nazarene Mohammed says, good night, Dr. Batson. A pleasant good night to you, Miss Natalie Smith. She says, I heard of the Nerve Restore. Can you kindly explain a little bit about this, please? Okay, good. No problem. I'll talk about it in a little bit for you. Nerve Restore. Okay, before I give you the Nerve Restore, let me just give you those telephone numbers. Excuse me. Yeah. So those telephone numbers again, 222-8261 That's 222-8261, as well as 314. Sorry about that. As well as 314-9975. Again, those telephone numbers are 222-8261. That's 222-8261, as well as 314. That is 314-9975. Good. Nerve Restore. So Nerve Restore is a product that I did. That product was actually done for myself first. And I'll tell you why. Because, you know, I have a schedule like almost like no other, right? I work hard, but I work smart. You know, it's work hard first and then work smart after, right? So because of my schedule and whatnot, I wanted something. I never had problems to sleep, but I was always in quest, or I always believe and understood that the better sleep you get, the better rest your mind would get, the better rejuvenation your mind would get, and the better you are to deal with the stresses of the day and that type of thing. So I came up with Nerve Restore. There was actually a client I dealt with on Friday who came to us. She came with a lot of issues and whatnot. And when she came, it was her review with me. And she said, Dr. Batson, that nerve thing you give me is magic. Just so she said it. She said, the nerve thing now. I said, what, the Nerve Restore? She said, I don't know. It's in a bottle, the nerve thing. And they tell me to take 2 a day. Watch me. She was so impressed. Watch me. Sleep like that. She said, Dr. Batson, I am sleeping like that. So I always challenge people. If you think you sleeping good, I challenge you. If you think you can't sleep, and you have sleeping problem for years, that people say, I have sleeping problem for years, 10 years now, I'm not sleeping good, 27 years, and listen to me. You're either doing stupidness consistently, and as Einstein once said, the only people who do the same thing over and over, expecting a different result, is what? Mad people. You're mad, you ain't right in your head. That is the height of insanity. So it means something you're doing. If you're sick, you have problem with liver, you have problem with your eyes, and you have diabetes for 25 years. Who does have a disease for 25 years? Really? Listen to me. We're living in the information age now. So they can't pull wool over your eye and fool you and talk stupidness for you. Anything you want to find out now in this world, you could find out. You see how fast things go on camera? Now when people fighting, they're looking to help you, and they're looking to take it to put it up on social media. That's the sad thing about where we reach in this world. But the point is, we live in a world where information abounds. Do not be, people just say, don't say stupid, but I just say stupid. They tell you, don't be stupid in this rounds. Read, educate yourself. It didn't take it long. The time you spend on social media to mind people's business and posting that you're not supposed to post, go and read it. And find out what you have. There are things that could help you. And when you need clarification, Batson Associates will do the clarification for you, gladly. And I challenge anybody out there, any single one of y'all, who have problems with sleep. I don't care which part in the world it is. We will help you. Because you know why? When you understand how the human body works, and believe me, this is no boast. I understand everything, but I understand a lot of how this body we have here, this work. And God in his wisdom, when he created mankind, because I believe in creation, I didn't believe me come from no monkey to tell somebody else that. I don't believe in that foolishness. I believe in creation. And if you had a creator, or if there is, in fact, a creator, the people who make the chair that I sit in now, the people who design the car that you're driving, there's a reason why. And if you have a problem with it, you just go to them. Because they are what? The manufacturer. So God in his wisdom, when he made mankind, he said he put things here for us. Food. But you have food, food, and food. And the last one, if you have sense, the food and food, the first two is not food. It are plenty things that I have outside in pack and box that all they given, all they children, and all they eating that is not food. Stop that. Eat better. There is an economic consequence to everything. What the Bible said? The Bible said money answereth all things. So I don't know your finances. I don't know your business where that's concerned. That's for you to know. But what I do know is this. If you do not take care of yourself, if you do not take care of your health, if you don't nip that diabetes that you have now in the butt, if you don't nip that eye problem that you have in the bud, if you do not nip that headache, migraine headache you have in the bud, if you do not deal with the fibroids and the polycystic ovaries that you have now, it is not going to go away. It is going to come wrong and bite you in that part of the body. Bite you hard, real hard, because you ignored the warning signs. I always tell people this: your body speaks to you, but most of the time they do not listen. If you don't know how to translate, or you want a translator, Batson Associates will translate for you. Because I could watch people and tell them how wrong with them, some of them. You know? You see the people who have very dark, this dark black mark here, by the side here, black, your forehead black, under your eye black here. And you must be about 2 shades lighter, you're a red woman or a red man, whatever the case may be. And you have all this blackness on the side here. You know what that is? You know what that is? That is poor circulation to your brain. You are a stroke patient in the making. And I say that without any apology, because I want you to know that that is signs that something is going wrong with you. Every single person who gets a stroke had signs and symptoms that they didn't know how to understand. When you hear people tell you they get a stroke and they didn't know how they get a stroke, I telling you they're talking foolishness. Foolishness. Serious foolishness. Because they did not know how to look at the signs. Yes, Jane Angel, Nerve Restore works for depression. It works for depression, it works for anxiety. And let me tell you something, I'll make a challenge again to anyone out there who's serious. Now, all I know I just tell all as it is, you know, because you can't come to me. You go by the mechanic. When I carry my vehicle, or the vehicle had to go to the mechanic, and the mechanic say A, B, C, D wrong with the vehicle, or you send your vehicle to service. You can't tell the people what you want to know. You might tell them, hey, I don't really have all that money, and they could understand that. But that is the parts that the vehicle need. You might be able to fix it part, but you have to fix something. So your body is the same. So that Nerve Restore, if you have depression and anxiety, Nerve Restore will help you. But you do not need that alone. You're going to have to dot your I's and cross your T's with some other things. But Nerve Restore is an excellent product. It is one that is well received by all our clients. There isn't a person who used that product correctly, because some of y'all cannot take 1 capsule. Some always 2 capsule people. That lady who came back to see me on Friday, the mess that she was in, she was a 2 capsule person. And she took it. She said, Dr. Batson, after I asked the woman, sit down. In fact, when I saw her in the waiting room, I knew she already was feeling good, just the way how she looked. She had a broad smile on her face. When she came to see me about 6 weeks before that, 2 months, she was in a complete and total mess. She said, Dr. Batson, I'm feeling like I'm going mad. I'm not sleeping. I have stress. I said, don't worry yourself, girl. I go fix you. And we sorted her out. And for today, she's happy. She said, that nerve thing, make sure I want 2 bottles. She bought, I think, 2 or 3 bottles at the Nerve Restore. She said, I don't want this to run out. So the Nerve Restore works. There are products. It has no product you'll get by Batson Associates that don't work. That is why after God, my reputation is so good. Because I pride myself on proper things. I'm not going to bring no rubbish and sell all. Yeah, I would never do that. Because how much people are a fool? I'm not in that. My objective is to get you better, quickly, and effective and efficiently. That is the important thing. So that's why I tell persons, when you come into us, come like you're serious and you're coming to deal with your issue, so that you could tell us at the end of the month, 2 months, or when we do your reassessment, 3 months, 6 months after, Dr. Batson, thank you very much. And you just do your little maintenance phase. You ain't even bound to come back in my office if you don't want to come back. I wouldn't vex with you for that. But most importantly, you were helped. Miss Jennifer Valentine say, I swear on Nerve Restore. I want right now. I hear you. Good product. So, you know, with that being said, I know there are some questions that I get here. Let me see which one. No Nerve Restore. No, we don't have Nerve Restore in Tobago. But you're Tobago getting your stuff this coming week here. Tobago, we have little 1 or 2 challenges we deal in. I don't understand why we Trinidad and Tobago are 1,000 million years and that air bridge and sea bridge could never work properly. But that's a different story for a different time. But we will work with what we have to work with. So, Miss Natalie Smith, you just bear with us and we will ensure that we get your products for you. As regards to Nerve Restore. All right. Marcella Smith asks, what do you have for internal tremor? Internal tremor is a central nervous system disorder. But people who have internal tremors, that is not only, that's your nerves that going bad. So you need to do a protocol as regards to that. We do have things for that. Nerve Restore will help. The anthocyanin complex is a very good product. That's actually one of my favorite products as well. Really good for eyesight, very good for the brain. I am big on things for proper mental function, proper mental, yes, Ms. Smith, you're welcome. Proper recall and that type of thing. Because I work very hard. I use my brain a lot. So I need to ensure that I keep it functioning well. Okay, guys? So it is now 9:40. Now, ideally, I would have liked to keep this live until 10 o'clock, but I'm working with a different piece of equipment here, which is a phone, that, you know, we actually did some changes. So I'm not going to stress the device for too much longer. I believe that, you know, when we do it like this, and because of carrying this, we usually do it on a computer system, but we had to do some changes, okay? Ms. Nazreen Mohammed, yes, we do have Nerve Restore in the penal branch. You could always call Ms. Roma and she will let you know. But we do have Nerve Restore at that penal office. Okay, guys? So this brings our program to an end. I'm sorry to leave so early with you guys. I'd like to stay till a little after 10. But as I say, we changed devices. We're not in our regular studio setting. But I didn't want to miss this program, so I still wanted to come. Miss Katian St. John said I missed her question above. All right, Katian, let me see if I could see your question before I go. All right, Katian. All right. Katian St. John says, Dr. Batson, what can I do to lower uric acid in my body? Okay, if you have high uric acid, no meats. So take out all red meats out of your diet. If you're using chicken, you can use chicken, but use like farm-grown or homegrown chicken and more fish. What you're also going to have to do, you have to look at your water intake. You can use Santulan. Santulan is a 7-channel detox that cleans and detoxifies kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. The problem with uric acid is that uric acid settles in the joints. So it actually settles in your knees, your ankles, and those type of things. So what you're going to have to do, there's a product we use at Batson Associates called Inflammation Formula. And that inflammation formula actually helps to reduce the inflammatory response. Because uric acid increases high inflammation in the body. All right, Mr. John? So your Santulan, your Alkagen water, inflammation formula is what will be able to help you. Okay? All right. So with that being said, keep in mind those telephone numbers and locations. Remember, we have some open clinic days in Debe. I'm going to be in that Debe office on the 27th and the 28th. We also have an open clinic day in St. James as well. That's St. James Clinic. And you could take advantage of that. Those telephone numbers again are 222-8261. That's 222-8261, as well as 314-9975. Again, that's 314-9975. Yes, and Miss Drayton, I need to get Nerve Restore in Tobago. Thank you very much. That's Miss Drayton, one of my clients there. Lovely lady in Tobago. Okay, guys, so, you know, as we always say at Batson Associates, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. Take care of yourself, guys. Remember, drink your required amounts of water. Don't eat too much of the meat, less of the sugar. Do something on a daily basis to give you a healthier life. That deep breathing that I told you guys about the early morning. Anyway, just now we're going to be starting a lot of things. We're going to be giving you guys a lot of content. I promise you that. And, you know, it's greater and greatness and better things coming in the near future at Batson Associates. And most importantly, for us to help you, to help those, to help your family. Because it always, I feel it's very difficult when you see family members lose family members for things that could have been corrected easily. Don't do yourself that. You get a wonderful gift. You get an excellent body. Take as best care of it as you can. Okay, guys? So, God's blessings. Take care. Be safe. And check out those telephone numbers again. 222-8261. That's 222-8261. As well as 314-9975. Take care, guys. God bless. Check out our program tomorrow, that program on hormonal disruption, where we deal with polycystic ovaries, fibroids, ovarian cysts, endometriosis, infertility, PMS, menopause, all the hormonal challenges, thyroid problems, all those things. Take care, guys. God bless. And we out of here. Bye-bye.